Okay, welcome back. We're going to do a deep dive today into a condition that's, well, pretty interesting visually and definitely relevant for a revision, perhaps, for the MSRA exam.
hmm
We're talking about erythema ab Igne. So the plan is to unpack the essentials, what it is, the causes, how it looks, and importantly, how it's managed.
Sounds good. Yeah, it's one of those conditions with a really distinctive pattern and a very clear cause and effect link. Makes it quite high yield to understand.
Right, so let's start right there. What exactly is erythema ab Igne, fundamentally?
Okay, so it's a skin condition. The definition hinges on its appearance, this characteristic reticular pattern. Think net-like.
Net-like redness.
Redness and pigmentation, yeah.
Yeah.
But the absolute crucial part is the why. It's caused by chronic long-term exposure to heat, specifically low-grade heat or infrared radiation over a period of time.
So not like a one-off burn.
Exactly. It's not an acute burn. It's that repeated lower-level heat exposure.
Okay, got it. And what kind of things typically cause this sort of chronic low-grade injury?
Well, think about everyday items. The sources often mention things like hot water bottles used frequently, maybe for chronic pain, or laptops, people resting them directly on their thighs for hours, even sitting really close to old-style fireplaces or certain heaters day after day.
Right, that consistent
So
exposure.
that cumulative thermal insult, basically.
Makes sense. So who's particularly at risk then? Are there specific groups?
Yeah, there are a few factors. People with jobs involving prolonged heat exposure, obviously. Anyone who regularly uses heating devices like those we just mentioned.
Hot water bottles, laptop.
Right. Also, individuals with chronic pain conditions because they often turn to heat for relief. And interestingly, some medications can actually increase heat intolerance, making people more susceptible.
Okay, so we know the heat's the culprit, but how does that repeated exposure actually create that specific net-like pattern we see on the skin? What's the pathophysiology there?
Yeah, it's quite neat, actually. The chronic heat does two main things simultaneously. First, it causes the tiny blood vessels near the skin surface, the capillaries, to dilate.
Making them more visible.
Exactly. And second, the skin responds by producing more melanin, which is the pigment. So you get this combination of dilated vessels causing redness and increased pigment causing browning or darkening.
And the net shape comes from.
It seems to follow the pattern of the heat exposure, perhaps related to the vascular network itself or how clothing protects certain areas, leading to that uneven reticular look.
That pattern does sound very distinctive. If you see something like that, though, what else should be on your mind? What are the main differential diagnoses?
Good question. History is key here. While the look is suggestive, you do need to rule out other things. Other types of dermatitis, like contact or irritant.
But
Certain autoimmune things, like cutaneous lupus, can sometimes show vascular patterns. And then there's levato reticularis that also has a net-like vascular appearance, but it's usually related to different underlying circulatory issues, often colder temperatures.
right, different cause entirely. Is erythema ab Igne common? Do you see it often these days?
Actually, the sources suggest it's become quite uncommon, certainly in places like the UK. The exact numbers aren't clear, but it's thought to be much less frequent now than it used to be.
Why the change?
Probably due to shifts in heating methods, less reliance on open fires or direct heat sources, and maybe better awareness about the risks of prolonged heat.
Okay, so when you do encounter it, describe the clinical features again. What exactly are we looking for and where?
You're looking for that classic reticular pattern, the network of erythema, so redness and hyperpigmentation, the darker lines. Location often gives clues, too.
Matching the heat source.
Precisely. Lower legs, thighs, think laptops, hot water bottles. The back, maybe from leaning against a heater, and symptom-wise, it might be asymptomatic, or the patient might report mild itching, or perhaps a burning sensation.
And given how characteristic it sounds, how do you typically diagnose it? Is it labs, imaging?
No, usually not. Diagnosis is primarily clinical. It really relies on recognizing that classic appearance and, crucially, getting a detailed patient history that confirms that chronic heat exposure to the exact area affected.
History is king here.
Absolutely. A biopsy is sometimes done, but really only if there's diagnostic uncertainty, maybe to rule out one of those differentials we mentioned, or if there's a concern about complications.
Okay, so history and the visual clinch the diagnosis usually. How do we manage it once identified? What's the approach?
Management is refreshingly straightforward in principle. The absolute number one, most crucial step is removing the heat source completely and avoiding future exposure.
Stop the cause.
Exactly. That's the cornerstone. For symptoms like itching or burning, you can use topical corticosteroids to reduce inflammation and emollients to soothe the skin. And then it's all about prevention, protecting the skin from that kind of prolonged heat going forward.
What's the outlook? What's the prognosis usually like?
Generally quite good if you catch it early and remove the heat source promptly. The redness, the erythema can fade, and even some of the pigmentation might resolve over time.
But if exposure continues?
Yeah, if it's been going on for a long time, or if the person doesn't stop the exposure, those pigment changes can become permanent. And this is the really important bit, though rare. In long-standing chronic cases, there is a small risk of malignant transformation.
Malignant, you mean cancer?
Yes, specifically squamous cell carcinoma. It's not common, but it's a recognized potential complication of very chronic, untreated erythema ab igne.
Wow. Okay, that definitely underlines the importance of diagnosis and management.
Hmm.
Are there other complications besides that rare cancer risk?
Yes. Besides the potential for permanent hyperpigmentation, you can also see skin atrophy, meaning the skin gets thinner in that area. And telangiectasias, those small, visible, dilated blood vessels can become more prominent and persistent.
So that pattern from, say, a laptop could potentially lead to skin thinning, persistent color change, or in really rare chronic situations, something much worse.
Exactly, which is why follow-up can be important, especially in persistent cases, to monitor for any changes.
Okay, so let's summarize the key takeaways for erythema ab igne. We're talking about a reticular skin pattern, redness, and pigmentation caused by chronic, low-grade heat exposure.
Right, think hot water bottles, laptops, heaters.
Diagnosis is mainly clinical, the look plus the history of heat exposure.
Mm-hmm.
And the core management is simply removing that heat source completely.
That's the fundamental step, symptom relief with topicals if needed.
And while prognosis is good if caught early, persistent exposure can lead to permanent changes and, rarely, that risk of squamous cell carcinoma.
Precisely. It's a great example of how crucial a detailed patient history is, connecting lifestyle and habits directly to a clinical finding.
Definitely. So for you listening, really consider how that history taking is paramount here. It's not just seeing the rash, it's understanding the why behind it. Missing that connection could mean missing the diagnosis and, crucially, overlooking that rare but serious long-term risk.
Well said.
For more free MSRA revision resources, visit freemsra.com, and for the full Premium Revision Toolkit, head to passthemsra.com.